In this video, we'll discuss dementia, its different sites, locations, and features. The dementia patients have memory loss or forgetfulness. So what's the difference between forgetfulness of aging and that of dementia? Normally, with increasing age, there is forgetfulness with slow reaction time and increased time to learn new information. It's not so progressive and not serious. There is no cognitive impairment in normal aging forgetfulness, and it doesn't interfere with activities of daily living. And what's amyloid angiopathy of aging? Like amyloid angiopathy of dementia, there is accumulation of amyloid in cerebral blood vessels also in old age. That produces older people to hemorrhagic stroke. So what's dementia? Dementia is a neurodegenerative disorder in which there is gradual deterioration of cognition, progressive decline in mental functioning. Cognitive impairment interferes with activities of daily living that leads to inability to perform ADL. Loss of memory with loss of orientation to time, place, and person occurs in dementia. Memory loss is the main feature of Alzheimer's disease, but in frontal lobe dementia, subcortical dementia, frontotemporal dementia, personality changes, attention, judgment, and behavioral disturbances occur early. Dementia is a progressive disorder but may become static or fluctuate day by day. What's mild cognitive impairment? MCI. MCI interferes with daily activities. MCI may progress to dementia. What are the factors that predict progression from MCI to Alzheimer's disease dementia? Factors that predict progression from MCI to Alzheimer's disease are memory deficit of more than 1.5 standard deviation from norm. Number 2, family history of dementia. Number 3, presence of apolipoprotein E4 or ApoE4 and small hippocampal volume. And what's mini mental state examination? Mini mental state examination test, MMSE. Mini mental state examination test can provide information regarding orientation, language, and visuospatial skills. It helps to confirm the presence of cognitive impairment. Mini mental status examination test consists of orientation, naming of object and repeating them, calculation, serial 7 subtracting from 100, 7 subtracting from 100, 93, 86, and so on and so forth. Recalling the object which were presented earlier. Language function, both motor and sensory, are tested. Patient is asked to write a sentence, copy a design, repeat numbers, name of some objects shown earlier. What's the disadvantage of mini mental state examination test? The mini mental state examination test is unreliable. Why? Because delirious patient is unable to follow commands and he cannot spell the words correctly. And also in frontotemporal dementia, earliest deficit often involves frontal executive length. In most patients with MCI, MMSE may be normal. Why does dementia occur? Dementia results from disruption of cerebral neuronal circuits. It's most often is associated with microscopic changes of Alzheimer's disease at autopsy. And number 2, slow neuronal mitochondrial mutation also contribute to increasing prevalence of dementia with age. What's the single most important factor in causing dementia? Old age is the single strong risk factor for dementia. 10% of the people of more than 70 years of age and 20 to 40% of people with more than 85 years of age have clinically identifiable memory loss. What are the most common types of dementias? Alzheimer's disease, that occurs in more than 50% of cases. Number 2, vascular dementia occurs between 10 to 20% of cases. And number 3, Lewy body dementia. Intoxication with alcohol and prescription drugs also cause dementia. Under the age of 60 years of age, frontotemporal dementia rivals with Alzheimer's disease as most common cause of dementia. So both Alzheimer's disease and frontotemporal dementia are the most common causes of dementia under the age of 60 years. Which dementia have positive family history? A positive family history of dementia is found in Huntington disease, familial Alzheimer's disease, frontotemporal dementia, or prion disorders. So, what percentage of patients of Alzheimer's disease have memory loss? 75% of Alzheimer's disease patient begins with memory loss, and in others, early symptoms are difficulty in managing money, driving, shopping, following directions, navigations, and finding words. So 75% of Alzheimer's patients begin with memory loss and the rest of them with these features. What are the neuropsychiatric features in Alzheimer's disease? In early stages of Alzheimer's disease, there are depressive features, social withdrawal, and denial of the illness. Later, the neuropsychiatric features of dementia are depression, hallucination, delusion, withdrawal, agitation, and sleep disturbances, reversal of sleep-wake cycle. In frontotemporal dementia, patients have less memory loss as the presenting feature and more behavioral problem. Unlike Alzheimer's disease, which have more memory loss, frontotemporal dementia patients have less memory loss and more behavioral problem, personality changes, apathy, and overeating with weight gain. In frontotemporal dementia, earliest feature may be disturbance of executive language function. The vascular dementia may be caused by thrombus, embolus, or hemorrhage that compromises perfusion. Motor and other focal neurologic deficits occur early in vascular dementia and late in Alzheimer's disease. There is acute hemiplegic motor weakness, hypertonia, hyperreflexia, spasticity, and slurred speech, and unilateral positive Babinski. Psychiatric features, personality changes, behavioral disturbances, delusion, depression, and psychosis. Multi-infarct dementia is associated with focal damage, that is hemiplegia and rigidity, and there is a history of sudden stroke with irregular progression suggest multi-infarct dementia. Dementia of Lewy body patients have more visuospatial defects. What are the sites involved in causing dementia or lesions of which cause dementia? Two sites, cortical and subcortical, and a mixed variety. Cortical dementia are Alzheimer's disease and frontotemporal dementia. And subcortical dementia occurs in Binswanger's disease or subcortical dementia, Huntington disease, Parkinson disease, multiple sclerosis, basal ganglia lesion, and lesion in the deep white matter. There is memory loss, pathetic, depressed motor speed, slow abnormal movements, and tremors, lack of facial expressions, and speech difficulty. And what are the examples of mixed one? Vascular dementia, dementia of Lewy body, and corticobasal degeneration. The corticobasal degeneration is associated with dystonia, alien hand, and asymmetric extrapyramidal, pyramidal, or sensory deficits or myoclonus. What's the relation of dementia and depression? Depression may mimic dementia. The two disorders often coexist. Depression may be the first manifestation of dementia. And what's the relationship between dementia and delirium? Both dementia and delirium are characterized by disorientation, memory impairment, paranoia, hallucinations, emotional lability, and sleep-wake cycle reversal. In delirium, deficit occurs in the area of attention, working memory, and frontal function. Patients with dementia and depression should be treated with non-anticholinergic antidepressants. So dementia may be reversible or irreversible. What are the irreversible causes of dementia? Alzheimer's disease, vascular dementia, and Lewy body dementia are the most common causes, and also frontotemporal dementia, HIV dementia, Huntington disease, and Creutzfeldt-Jakob disease. What are the three most common reversible dementias? Depression, hydrocephalus, normal pressure hydrocephalus, and alcohol dependence. Other treatable causes of dementia are prescription drugs, subdural hematoma, and endocrine disorders, hypothyroidism, and Addison disease, and toxins. Alcohol, benzodiazepines, anticholinergic also cause dementia. Heavy metals, bromide, and lead. Kidney liver failure decreases drug clearance and cause drug toxicity. Metabolic causes, chronic hepatic encephalopathy, Wilson disease, uremic encephalopathy, and dialysis. Vitamin. Which vitamin deficiency causes dementia? Pernicious anemia, folic acid, and thiamine deficiency. 3 years after gastrectomy, loss of intrinsic factor causes vitamin B12 deficiency.